So as we age, we also experience more exposure to the sun overall, right? After summer, we've been taking that family trip to the beach and so forth, and we've started to notice sunspots on our body. Would nitric oxide support any benefits there with handling sunspots?
Look, there's a lot going on with that, and most people, unfortunately, are using sunscreens. And what we're finding is that the exposure to the sunscreen is actually more toxic and damaging and dangerous than exposure to the sun. You know, anything in nature, you can overdo it. You know, too much exposure to sunlight is obviously going to burn the skin, cause damage, and then depending upon the health of that particular person, how are they able to repair and replace that damaged tissue? If they're unhealthy, then no, they're not, and they're probably going to get age spots, and they're going to get sunspots, and the skin's not going to repair. People who are healthy, yeah, you may get a sunburn, you'll exfoliate, you'll peel, but then you just replace those damaged cells with normal cells that function properly, and you don't get the sunspots. But here's the problem. I think that is what I tell people all the time. I don't use sunscreen. I think the dangers and risk of most sunscreens out there far outweigh any benefit. I mean, sunlight is healthy. We need sunlight. It controls our circadian rhythm. It controls, you know, blood pressure by the release of nitric oxide. It regulates vitamin D metabolism. I mean, everything that we know about physiology, the sunlight plays an important role in it. So, look, 20, 30 minutes, maybe an hour, depending on the time of the day, where you live, where you're exposed to the sun. But you just have to cover up. You can still enjoy the beach. Wear a long sleeve shirt, wear a cap, wear a hat, and just cover up. You can still enjoy the outdoors, but I think smothering yourself in a toxic, aluminum-ridden, you know, chemical-ridden sunscreen is far worse. It causes more health consequences than exposure to the sun.
You know, it's actually kind of funny that you mentioned that, because when I notice different lawn companies, or when you charter like a fishing boat or something like that, you don't see them shirtless wearing a bunch of sunscreen. You see them wearing long sleeve shirts.
They're completely covered.
Just completely covering every inch of their body. So that actually,
yeah, even on the you know, the people who work on the highway, like here in Texas, the Department of Transportation, people who are working on the roads, they're completely covered, even in the summer when it's 100, 110 degrees on the roadway. They got hats on, they got long sleeve shirts on, they've got bandanas covering their neck, and so they're protecting themselves from overexposure of the sun. But yet, they're still out there. Even though you don't have the direct sunlight, you're still getting the benefits of sunlight and the radiation from natural sun. And so where people who are using sunscreens completely shield that, and they're getting the consequences of the chemicals in that sunscreen.
Okay. What about hyperpigmentation?
You know, I think, again, more people are more susceptible. Certain people are more susceptible to that than others. And again, it's the body's ability to respond to an insult or injury, right? And people who have hyperpigmentation typically have some type of compromised ability to respond to that trauma or that stimulus. So I think if we focus on what it takes to be healthy, again, give the body what it needs, remove from the body any toxins, and the body's always going to respond, right? We're constantly bombarded with insults from toxins, from the environment, from the food we eat, from trauma. And healthy people recover and they repair. And that's because their body is adapted to be able to mobilize stem cells, repair and replace dysfunctional cells, downregulate the chronic inflammation, prevent immune dysfunction, oxidative stress, and the body's able to heal. But if you're compromised in that, then a lot of things happen. I mean, you call it hyperpigmentation, but it's really the inability to respond to some trauma or stimulus.